This is our clinician webinar called What About the Kids? Help for Those Caring for Adult Oncology Patients. I know a lot of you registered in the last 24 to 48 hours, so just really grateful that you're all here and that you're receiving our emails and ready to learn more about how to support your parenting patients, or maybe you're feeling already really confident doing that and you just want to walk away feeling even more affirmed in your approaches. I see the chat is active. All right, I'm just managing everyone coming in. All right, welcome. I see we've got folks from all over. We've got Los Angeles, Colorado, Arizona, Chicago, New Jersey, Lenox Hill, New York City, North Carolina, Alabama, Maine, Wisconsin. Amazing. Louisiana, New York, Minnesota. All right, Lake Forest, Illinois. Awesome. Nebraska, Texas. Great. Thanks so much for being here, everybody. I'm going to let people in as we go. It's just me here, so I might be a little bit managing the different controls, but really excited to be with you all for the next hour to talk about how to support parenting patients. My name is Kelsey Mora. I am the Chief Clinical Officer for Pickles Group. My background is that I'm a dual certified child life specialist and therapist, and I'll share a little bit more about that shortly. But before I do want to get a sense who's in the room. So I am going to release a poll, and I'm also curious if you'll be at ASCO in Chicago. So I'm based in the Chicagoland area. We know that this really large oncology conference is happening in just a couple weeks in our home city of downtown Chicago. And so would love to connect with some of you there in person. We will have a booth, and so we'd love to meet you. So if you will be at ASCO, let us know that in the chat as well. And I'm just going to release the poll quick and hear a little bit from you all. What brings you here? All right, so you should see the poll. There's 3 questions. Curious what setting you're in, what role, and how comfortable you're feeling talking with kids about cancer. So if you take a minute to, I see some of the responses coming in. Awesome, thank you. So far, everyone, okay, outpatient clinic and inpatient hospital. I'll share the results. I see we have a lot of social workers here, some nurses, some child life specialists. Most are feeling okay, but could be better. Okay, awesome. I'll give everyone a few more minutes. We're at about 80% completion. If you're in a position where it's not safe or accessible, obviously we don't expect you to respond, but I'll let everyone do so, and then I'll end the poll. All right, I will share those results. All right, so we've got over 54% of you are working in outpatient clinics, as well as about 11% in the inpatient hospital. I see quite a bit of others, so if there are other areas that you're working in that you'd like to share that with us, let me know. In terms of clinical roles, a lot of social workers, some nurses, some therapists, and some child life specialists. Welcome. And most are feeling okay, but could be better. So I see there's a few of you that are feeling super comfortable. I'm so glad that you're still here. Hopefully you can even share some of your best practices and your experiences throughout this discussion. And hopefully you'll add to your toolkit as well. And then for those of you who are needing some help and could be better, I'm really hoping that you'll walk away feeling more confident in having these difficult conversations. So thank you for filling that out. All right, so a little bit about me, and I apologize for my mouse moving around. I've gotten that feedback before. It's really just me letting people in from the waiting room, so I will try to keep that to a minimum as soon as everyone is here. So I am a former hospital-based child life specialist. So I worked in a children's hospital within an adult hospital, and would specifically I was in the pediatric ICU, but I covered a lot of areas, and we were often getting called to the adult side. So our pager would go off. We had a team of about 14 child life specialists, and whoever was the most available or the most accessible would go and respond to the referral. And often it was kids coming to visit their parent in the hospital, or parents asking, what do I tell my kids? And we would respond, but it was a really short interaction. We might provide some resources, we might provide some guidance, maybe we would have the opportunity to work directly with the kids, but then that was kind of the extent of what we could provide. And so I know that every hospital looks a little bit different, every clinic looks a little bit different. Knowing that many of you are in outpatient clinics, you may or may not have access to dedicated people to have those conversations. And so really just identified a gap here. And so I am a dual certified child life specialist and therapist. I am a private practice clinician. And our three founding families were looking for support for their own families to navigate this experience of having kids who have a parent with cancer. So I worked with them to support their own families. And from there, they really had this vision of making this accessible to more families. So we are going to be 4 years old in September, and we have really reached a lot of families at the national and international level. So we have a psychosocial emotional curriculum where kids can go through the program to learn a little bit more about cancer, connect with other kids, and have that wraparound support. And it really starts with you. It starts with the clinicians having the words and the confidence to ask families, who are the young people in your life? How are your kids doing? And feel like you have some go to resources or language to start that conversation so that parents then go home, feel more equipped to have honest conversations with their kids, and then eventually perhaps enroll their kids in this peer-based support. We recognize that our support kits, our webinars, our YouTube channel may be all that a family needs, and we are so grateful to be able to provide that. If and when a family needs more support or their kids are ready for more support, we've got our youth programmings as well. I'm also the author and the creator of the DOT Method, which is an interactive workbook to teach kids about cancer. We have a list of a bunch of curated resources on our website, including a lot of our partner organizations, as well as different options for books and resources, both for cancer and end of life. So I'll talk more about that at the end, but that is available on our website as well. All right, so I want to just ground us in this necessary topic. So you're going to see some quotes populate on the screen. I want you to think about your patients, the families that you work with, the setting that you work in, and how and when these conversations come up. So the title of the webinar is What About My Kids? Often families want to know, what about my kids? And we are throwing so much at them at the beginning and all throughout their treatment. But they might be sitting there really wondering, what about my kids? What do I tell them? How are they doing? This also comes up a lot in those outpatient clinics, those infusion centers where parents are maybe sitting for longer periods of time. They're waiting around. Maybe they have our poster in the infusion center and they see it and it makes them think, oh, I need support for my kids. What are they thinking? What are they experiencing? How am I going to tell my kids? This is that common question that parents may have at the time of a new diagnosis or a significant change. I don't want them to be scared. Parents might know they need to be honest, but they might not know what to say. They might not know how honest to be. They're worried it will scare them. I have to be strong for my kids. This is a common one that we hear. I'm sure if I could see you all, you would be nodding that, yeah, parents really feel this responsibility to be strong for their kids. But what exactly does that mean? And I can't let them see me upset. So maybe they're, holding it together and feeling this responsibility to not show how they feel in front of their kids. And I'm going to challenge that a little bit today and talk about how parents can show how they feel and support their kids. So, in terms of what we're going to cover today, I want to cover understanding developmental responses by age. So, our youth programming is for first through 12th grade, but all of the content that we provide is really for the full developmental spectrum. So, the littlest infants, toddlers, all the way through adolescents. I'm hoping that you can walk away feeling like you can master these tips to guide your patients when talking with their kids at home. Get ready for those what about the kids questions, and then also identify how and when to use both internal and external resources, including Pickles Group. So I want to start for those of you who are maybe newer to the organization, or maybe you need a refresher, or maybe you're really familiar and a huge champion of Pickles Group. I want to make sure you really understand what we're about because I think it just grounds us in this topic. We approach everything from three main pillars. So the first is honest and age appropriate information. Research shows that when kids understand what's going on at their age or developmental level, that they can feel more comfortable, more confident, more at ease. And so that is one of the main things that we really want to help parents with is having these honest and age appropriate information for their kids. We also know that when kids have coping skills, they have an easier time thriving through life challenges. And these skills are transferable to everyday life. And so sometimes they're well established before cancer enters the world, sometimes they're not. And either way, they're going to be really helpful throughout life. And then the last is connection to peers. We know that everyone needs that connection with other people who get it. And Pickles Group is really about bringing with other kids. So we provide free peer to peer support and resources for kids and teens impacted by their parent, guardian, or caregiver's cancer. All right, so I'm going to start with these common questions that we see from kids. So this is rooted in the 4 C's that comes out of Canada. It's really applicable to both cancer conversations and grief and end of life, which for those of you who are more interested in that advanced and end stage cancer conversation, we are having in November a how to talk to your kids about advanced and end stage cancers. I also did a clinician webinar, kind of a 2.0, really focused on those end of life conversations that was really well received. We partnered with AOSW. So we're hoping to offer that later this year as well. So you're going to have a survey at the end of this. And if that's something you're interested in, I'd love to hear from you. And so that we can offer that later this year as well. So what you see on the screen is actually real questions from real Pickles kids. This is the first time we ever did this, where kids were able to anonymously write down their questions about their parents' cancer. So you can see on the screen, I'll read a couple out. Can brain cancer make you forget your memories? What does chemo look like? How long until my dad's treatment kicks in? What if it gets worse? How did this happen? What causes cancer? Why us? If the medication doesn't work, will there be backup? And so just because we're not talking about it doesn't mean kids aren't thinking about it or worrying about it. So when given a piece of paper and a marker and the opportunity to ask big questions, this is what they ask. Now we continue to do this in all of our Pickles programming. So we have something called Phone a Pickles Friend, where kids can actually submit their questions, and we get a ton of questions every week, every month, and we continue to provide honest and age appropriate responses to our community. So those questions are often, can I catch it? Kids don't always understand that cancer is a different kind of sickness, that it's not caused by germs, it's actually caused by a problem with the cells. And so they might worry that it's contagious. They might be scared of hugging or interacting with their parent. As a result, we also want to explain how cancer works, and that some of the side effects are that someone's immune system can be compromised. So that while they might be more sensitive to germs, they can't catch or share cancer. Cancer is not a germ. Did I cause it? Kids often feel, you can see right here, what causes cancer? Kids may even have magical thinking where they actually feel responsible, that maybe they did something to cause it, or maybe their parent did something to cause it. So we always want to help kids know that this is nobody's fault, and we don't know exactly why cancer happens, but it's never anybody's fault. One thing that is a common experience is this wanting to fix it, right? As parents want to fix things, but kids want to fix things too. And so they might be asking, like, can we cure it? What can we do about it? And so helping kids understand that, the medical team and the scientists are working really hard to figure out how to treat cancer. We even have done an activity called the worry backpack, where often if kids are worrying about making the cancer better, we might even move that worry to the medical team's backpack or the scientist backpack. That your job is not to worry about curing it. Your job is to take in the information where other people are worrying about trying to make it better. And that may mean having a conversation with a kiddo that it's not that it when it's not curable. I see there's some messages in the chat about sharing out the slides. We will be sharing the recording with all of the registered participants. Yes, so that will be available. Who will take care of me? So this is a big question. We always want to understand, like, what exactly is a kid thinking about when they ask this question? They may be wondering, who will take care of me if you die? They might be wondering, who will take care of me if you don't feel good? And so figuring out what are they worried about, and then being able to brainstorm with them, who are some of the support people in our life? Who can help us? Who can we turn to? Or if I do die, here's my plan for who will take care of you. So figuring out what exactly they're wondering and how we can address it. So now I'm going to talk about specific age groups. So infants and toddlers are that age group that we often think, they're too little to understand, they'll never remember. I actually want you as clinicians in the room challenging that. And you may already be like, yes, I know that infants and toddlers, that this affects them. And so we want to be the champions and help parents understand that too. Like, yeah, you're right. They probably won't understand very much. And that doesn't mean it doesn't affect them. They still sense what's happening around them. Let's think about their experience. Suddenly you're in the hospital and you're your primary caregiver and you're not with them. Or maybe there's a bunch of families showing up and everyone's emotional, or maybe their feeding routine has changed. So let's think about how this is affecting them. And we may not be able to fully explain it to them, but we might be able to work on how to help them regulate their feelings. We know that when a baby is crying and a parent is really stressed or amped up, that baby has a harder time calming down. And so something as simple as having a parent take deep breaths and regulate their own nervous system can actually really help calm an infant down. And so thinking about how this might actually be affecting infants and toddlers. The toddlers often stand out to me because when we think about caregiving, they're relying on their caregivers quite a lot. With same with infants, but in a way that they can understand. So they want to be held. There's toileting care, there's feeding care. And so when a parent is maybe not as mobile or maybe can't carry them because of a surgery, that can be really hard for a toddler to understand. And they might even think, my mommy doesn't love me because she won't hold me anymore. And so we want to help them explain, mommy has an owie from a surgery. And, I've even done body outlines where we're putting band-aids on where it hurts. So helping toddlers understand that mommy loves you and she can't hold you right now. Let's find other ways to interact and connect. So really trying to think through, how is this affecting the infant and toddler, and how can we try to work through that? Preschoolers start to have more understanding, but this age group is really important because they're often relating it to their familiar experiences. So when you think of a preschooler, they might be learning how to cough in their elbow or blow their nose or wash their hands. And so this is the age group when it's really important to explain that cancer is a different kind of sickness, that it's not caused by germs, it's caused by a problem with the cells, and that the symptoms may look really different. So they might think of sickness and think, oh, runny nose, cough, fever, take a medicine, stay home from school, maybe home remedies and you'll feel better. That's not how cancer works. In fact, it can be really confusing because treatment can make someone feel a lot sicker before they get better. And so really explaining that to preschoolers in a way that they can understand, because they're often trying to make sense of things on their own. This age group has a lot of magical thinking. So for those of you who don't know what that means, it's like being magical, being fantastical. And so they're trying to make sense of things, and they might do it in a really way that's really different from what's happening. And so we want to help them understand what's actually happening and use really concrete language. Elementary age. So these kids are out and about, they're going to school, they're interacting with peers, they're attending activities. So they might have increased understanding, but they also may have misinformation. If we don't talk to them about what's happening, they may try to put the pieces together. They may ask a friend, they may ask Google. And so we want to make sure that this age group knows that it's an okay thing to talk about. I'm sure many of you are wondering, so what do we do when a parent doesn't want to talk about it? And we will talk about that. But right now, this is kind of just talking about what different age groups may want or need. And then adolescents. This is kind of that other forgotten age group because we think they understand more than they actually do. We also think that they're capable of more. We might give them more responsibility, and we might forget that they're actually really struggling with their role in the family. Teenagers are very egocentric. They're very focused on themselves. They care a lot about the things that are most important to them, often friends or hobbies. And so suddenly when their world is turned upside down, they might be really mad or annoyed that, like, this is affecting my life, and not in a selfish way, but just in like a perspective way. And so wanting to really work through how to prioritize what's important to them and be really clear about their role in the family. And so this, even just talking about those feelings and those challenges, can be really important for teenagers. So at Pickles Group, we have something called the Family Cancer Support Kit. For those of you who have not seen this, although I hope everyone on the call has seen this, and if not, right after this, you're going to go to our website and request some, because you can request it for free in English and Spanish. We will mail them to you. You can put them on a shelf and you can hand them out every time you know that you have a patient who's a parent or they ask, what am I going to tell my kids? What about my kids? It has these tips in there. It has child-friendly language. It has common questions that kids ask. It has a family-friendly activity, and it's completely free and available to you. And it's been designed with a lot of care and collaboration in mind. And these are being distributed to tens of thousands of hospitals across the country and globe. So we'd really like you to be part of that if you're not already. The reason I'm bringing that up is because we do have the 3 guiding tips for talking to kids and teens about cancer, and those are in there directed at a parent. Today, I'm going to talk about those tips, but I'm going to tailor it to you as the clinician talking to a parent who's talking to their kids. So these tips are sharing information, sharing expectations, and sharing feelings. Now, I want to make sure it's really clear that these tips are not just for that initial diagnosis conversation. These tips can be for any difficult conversation throughout the cancer experience. So it could be talking to kids about hair loss. It could be talking to kids about a parent's changed abilities. It could be talking to kids about a surgery, a relapse. So really knowing that once you've got these tips down, they can really just be applied over and over again. In fact, I'm going to talk about this shortly, but we really want these conversations to be held in bite-sized conversations rather than throwing everything at a kid all at once. Okay, so I'm going to start with sharing information, and I'm going to dig a little bit deeper into how we do that. So the first thing parents are often wondering, and they might be asking you, is how do I tell my kids? How do I tell the kids? And so we want to help them think about where, when, and who to do that with. So is there someone that can support them? Especially, I know there's a lot of social workers in the room. You're often the one supporting the patient directly. Who's in their circle? Who can have this difficult conversation with them? Is there a co-parent? Is there a friend? Is there a professional? Thinking about where and when, often we want to aim for a neutral time and place. So not right before bed, maybe somewhere in the middle of the day, middle of the living environment. I often guide parents on trying to make sure their kids are well fed and well rested, just to kind of give them the best foundation for having this difficult conversation. And I always let parents know that kids may not always reciprocate that same level of thoughtfulness. So their kids will ask them questions when they're hungry and when they're tired, but trying their best to prepare for difficult conversations that they're leading when their kids are in their best state. It's always helpful to have parents provide a warning. So, encouraging parents to say something like, I have something important to tell you. I have something difficult to tell you. We got some hard news today. What that does is it helps kids' nervous system pre regulate. So, if you think about if we just start with, I have cancer, your body kind of automatically goes into shock or a fight or flight mode. But when we say, I have something difficult to tell you, it just helps that system regulate a little bit more so that that panic or that shock or that fight or flight response is perhaps a little bit lessened. And so it kind of softens the blow. That can be really helpful, and that can be a tip that can be helpful even in the healthcare setting of we all. I'm sure you've all done this, like sitting down and giving, I have one. I'd like to go over your results with you. That is a tactic that actually helps the nervous system pre-regulate. What do I tell the kids? So when you have a parent who's asking, where do I begin? What do I say? What do I tell them? You might help them think about an age appropriate version of the truth. So if you have a parent who's like, I'm not telling them this, they don't need to know, I can't talk about it, they're too little, you might ask, let's think about what they might need to know. Like, what are they actually experiencing in their environment? Where do they think you are right now? Are we on vacation? Are we at work? Right? Like, what are we telling the kids? And so, really trying to assess what do they know already and how is this affecting them? Certainly, if a parent's coming home from a surgery and going to have visible changes, kids are going to be curious about that. What are they going to see? Maybe they witnessed a medical event at home. Maybe they're seeing a parent be seemingly more tired or emotional. So, that can help meet a parent where they're at is what do you think your kid is picking up on? What are they noticing? Some parents will say, I think I did a really good job hiding it. I don't think they know anything. So we might have to dig a little bit deeper. Kids are really curious and really insightful, and they do notice small changes in their environment. So that's the need to know. Let's think about what your kid really needs to know. What are they seeing? What are they experiencing? What are they witnessing? If we start with what they need to know, that might lead us to what they want to know. So that's when they may ask questions, they may express concerns. So, of course, parents have to be ready for that. I don't know is a real answer. We can encourage parents to say, if your kid asks you something really hard that you're not ready for, you can say, that's a good question. I don't know. Let's come back to that. But really trying to help parents think about what their kid needs to know right now. And then, what about my kids? Like, are they going to be okay? And so, helping parents know that the goal of this is really to open the lines of communication, to build a foundation of trust, of openness, of honesty, and really then following their lead. So, just kind of opening lines of communication. Really, what this does is it builds trust. We want kids to hear this information from their most trusted adult. It can be really challenging if a kid doesn't hear it from their most trusted adult and then they hear it somewhere else, or a friend says, what's wrong with your parent? And then suddenly they're coming with all these questions, and then it disrupts trust, throughout the process. So really trying to be proactive about them hearing information directly from their parent. I see there's a question about tips for clients who may have children on the spectrum and how to explain, neurodivergent youth. Yeah, absolutely. So the the best practices are still really the same in terms of being honest and sharing information, but it may be adjusting the delivery of the information. So it may be needing to be more simplified or more concrete or visual, really figuring out like how does that child learn best? What accommodations do they maybe have in their academic environment? And how can we modify this information to match that approach, style, and delivery so that it's clear and it may just take them longer to process. They may really need concrete explanations. They may need to get their hands on materials to really understand what's going on. And so of course, all kids are different, and really thinking about how does my kid learn best, how do they interpret information, so that I can tailor it to their development. There are some books that are better than others for a child who is neurodivergent. There's even one specifically designed for children who are autistic, and that book is on our list of resources on the website. Okay, so I'm going to move forward to sharing expectations. So one thing that can be helpful to work through with your patients is encouraging them to communicate around big changes. So, if we start the conversation early, I just was guiding a parent on talking to their kids. They had a new breast cancer diagnosis. They didn't really know the treatment yet, but they were really open to being honest about, hey, we got this hard news. We know that mom has had a bump in her breast and it's made up of cancer cells. So I want to learn more about cancer. And then as we have information about the specific treatment, we'll talk to you about that as well. Some parents lean more towards wanting to wait till they have all of the information, but that can just be a lot to have to talk about with kids, especially when kids are maybe already picking up on some things in their environment. So parents may be like unsure when to start. And honestly, my advice is starting as soon as you have information so that you can really start the conversation, build some language, and then build on the conversation from there. So encouraging communication around changes, good, bad, or otherwise. What will be different? What will be the same? You're still going to go to school, but the neighbor is going to take you. What about the unexpected? Kids will have an easier time coping with the unexpected when they understand why. So remember how mom has those cancer cells and the medicine makes her more sensitive to germs? Well, she had a fever today, so she has to go to the doctor to be extra careful, right? Easier to have that conversation than, oh no, what am I going to tell them? They're coming home from school. Mom's not in the house. They don't even know mom has cancer yet. So, really being able to build on previous conversations to navigate the unexpected. It can be really helpful when parents feel totally chaotic, giving them a sense of control. We can't control the situation. We can control how supported your kids feel. Let's talk about that. Things feel really out of control for you. They probably feel really out of control for your kid as well. Let's talk about that. How can we give kids a sense of control? We can provide them with choices about how involved they want to be with the cancer. Do you want to come visit? Do you want to make a picture? Do you want to help me pack? Or just everyday choices. Do you want the blue bowl or the red bowl? Sounds silly, but it helps kids feel a sense of control. Continue to parent. Often, parents may feel like when a family is navigating cancer that they want to be more hands off and more loose with guidelines and rules. And that feels good in the moment, but it can make it a lot more challenging throughout the experience. And so remembering that kids actually really benefit from structure and routine and predictability. And so by keeping some of those things consistent, that can help you parent. It can also help your kids feel a sense of stability when everything feels chaotic. So giving parents the chance to parent. I've had kids tell me, I don't want to talk to my parent about my homework. They have so much going on. And then parents are often like, I really want to help them with their homework because that helps me feel normal. Makes me feel like a parent. And so helping parents recognize that they want to continue to parent and how can we figure that out? You might be working with a parent who is really struggling with what they can't do. Maybe they are struggling with being physically active or with their memory. And so trying to figure out, this is common with brain cancers and some of the physical or emotional changes that can happen. And so thinking about not only I can't run, but how can I engage in a different way? A common example I'll give is, maybe you're really used to doing like dance parties with your kids or competitions. Instead, maybe you're sitting in the chair and playing DJ or playing judge or referee? Like, is there a way to engage that allows you to still be involved and connected, but also is accommodating to and adaptable to the changes? Addressing the what ifs. You're sitting across from a parent who has all kinds of what if thoughts. What if this? What if this? They're looking way far into the future. Kids may or may not be doing that. And the kids who are doing that will really benefit from a parent who slows their own brain down and takes things one step at a time. So let's go back to that need to know. What do you think your kids really need to know right now? Let's take this one step at a time together. And encouraging when possible them asking for help. Every family support system is going to really look different. So of course you as the experts in their care are asking, who's in your support system, who can you ask for help, who can help take this off your to-do list. And when that's not possible, that may be when we're leaning on some of those external resources that we'll talk about. And then the third point is sharing feelings. So this is when that I have to be strong for my kids comes in. So you may have a parent who really feels like they have to be strong for their kids, and you might ask them, let's talk about what being strong really means. Because they might be thinking being strong means holding it together, not showing any of my emotions, not talking about it, taking care of them my normal way. But being strong might also be an opportunity to model, teach, and support their children through really hard things. Um, that may be teaching them how to be strong because parents want their kids to come to them with hard stuff, but then we have to talk to them about hard stuff too. And so, really trying to unpack what does being strong really mean and how can we figure out a way to be strong in the context of having cancer? Because it's normal to feel upset, it's normal to feel overwhelmed, it's normal to feel confused. There's no exact playbook for this. Maybe it's an opportunity to really navigate it thoughtfully with your kids. Parents might say, I can't let them see me upset. And that's a common question I get. Like, is it okay to cry in front of your kids? So yeah, it is. It's really kind of gives kids permission to express their own feelings and be sad and cry if they need to when they see that their parent is able to do that as well. Now, of course, there's an extent to that. So if you feel like the person in front of you is really struggling to an extent where their child is having to console them and it's out of proportion with the situation, that might alert you to navigating your own support approach to them and their needs. But certainly, having a cry, talking about this, and getting emotional is totally normal. And thinking about joy, because sometimes parents and kids will feel like, everything has to be sad. I was just talking with a teenage girl recently who was like, it feels sometimes wrong to like be happy and play and have fun when this is going on. It is okay. It is okay to feel happy and sad in the same sentence. And so that can be really, really validating to normalize the range of emotions, both good, bad, and otherwise. Helping your patient identify their own coping skills and support system will be a great step in them modeling for their kids how to identify their own coping skills. So, what helps you when you're really upset? What would it feel like for your kids to see you doing that, right? To be able to actually say, I feel really overwhelmed right now, and I'm going to take a deep breath and walk outside for a minute. And for kids, that doesn't show them a parent who's not strong. That actually models for them how to handle really difficult moments effectively. And then parents will often say, I don't want them to be scared. So there's this common misconception that, cancer is automatically scary. And often that's projected from the adults. Kids don't really know how to feel about cancer or even death aside from the way that adults act about it around them. So I've been doing a lot more on, death and grief. And like I said, we have another clinician webinar on that, in the second part of the year. And even just if you're walking outside and come across a dead bug, it can feel so hard for adults to just say like, yep, that's a dead worm, because we have these taboo around these topics, and so therefore it teaches kids that it's not an okay topic, or that it's more scary than it is, and that we should avoid it. And so I often tell parents, kids are often more scared by what they don't understand. So, like, what's wrong with that worm? Why isn't it moving? Why is it like smashed? Like they're going to be really curious. And if their parent is not explaining that to them, that can feel more scary. And so, really, knowing that, like, actually explaining what they're seeing and experiencing can actually help reduce fear. It builds trust, and we can't fix it. We can't make it easily better, but we can provide them with support over solutions. So, really for you with the parent really empowering them that this is actually such an opportunity to teach your kids and model and to connect through this hard thing rather than feeling this need to avoid it. So those are the three main tips. We have share information, share expectations, and share feelings. And so it really gets down to sharing the need to know, communicating around changes, and then modeling and naming and practicing feelings and coping. Another thing I'll add related to sharing expectations is that often parents might worry, if we start talking about it, is it all we're going to be talking about? Not necessarily. Often, when kids start to trust that their parent will update them when there's changes or updates, or they can ask their questions when they have them, parents start to really, or kids start to not ask as much because they know, okay, we can act normal in between. If I have a question, I can ask. And if there's an update, my parent will tell me versus worrying and waiting. Are my parents going to update me? What aren't they telling me? So it actually, by opening the lines of communication, sometimes it creates actually more normalcy because the conversations are just a little bit more organic. Okay, so I want to talk a little bit about grief, and not in the context of loss of life, but I'm sure everyone in the room would agree that a cancer diagnosis equals grief, loss, and change. So the second there's a cancer diagnosis, there's a before and an after. And our kids are experiencing that as well. So they're feeling this loss of the way things were before, the loss of normalcy, the loss of childhood. A lot of these kids feel like they need to grow up faster. They're doing things that they weren't doing before. The loss of connection to others and relatability. That's why Pickles Group started. Our founding kids were saying, my friends are trying, but they just don't get it. Loss of predictability and plans. It feels really hard. We don't know what tonight's going to bring, let alone tomorrow. How can I possibly plan for my birthday this weekend? So kids feel that loss and that change. And Pickles Group really gives them a space where they can connect with other kids who get that in a different way. So we're gonna work on getting ready for the what about the kids questions, and so I'll pop those questions back on the screen, and we'll talk about different ways to respond. But before we do that, I also want to talk about something called the Pickles Way. So I mentioned, support over solutions. This can be helpful not only for kids but also adults. So if you have a patient who's having really hard questions and worries, they also might be looking to you for support over solutions. So reminding even yourself that, like, I can't fix this either, but I can help them feel heard and seen. When a cancer diagnosis happens, and it sounds like there's a lot of social workers in the room, there's also nurses, you're also meeting with patients in a lot of outpatient environments. So it may or may not be, when there's a lot of acute things happening, but often there's a bunch of people coming in the room. There's even someone coming in, checking on insurance and demographics and all these things. And it's just so overwhelming. And if that parent is sitting there just thinking, what about my kids? What about my kids? And no one's asking about my kids, they're probably not hearing a lot of the other stuff, like how to get their meds filled, how to schedule the PET scan, when they need to come back, who's who in the room. And so if you're the person who asks, who are the young people in your life, or you find out that they're a parent, we also want to be sensitive to those who maybe are not parents, but being able to really be the one who's leaning into that will help in and of itself a parent feel seen and heard. Like, oh, this person gets that all I'm thinking about are my kids, and I can't really focus on anything else. And that's why we want that family cancer support kit to be available to you so that it's a resource at the very least that you can give them to start addressing those questions and concerns alongside all of the other important things for their care. So when we listen first, it helps us figure out what they're worried about and what they're thinking about, which then allows us to validate, which really lets them feel seen and heard. It might just be reflecting back exactly what you heard. It sounds like you're really worried about your kids. Sounds like you're wondering how to tell your kids about your cancer diagnosis. Let me help. Let's talk about that, right? So listening first so that you can validate and then reassure. Now, reassure may be where the problem solving comes in. Maybe it's when you're handing the resources or you're calling your colleague who maybe is available to have a more in depth conversation. It might also be just kind of a continuation of that validation. Like, I get that this is really hard. What other parents have found helpful is, or I wish things were different, or parenting is hard enough. This is so hard. So really reassuring that, like, their questions, their concerns are totally valid, and we have some resources that we can share with you. So listen, validate, reassure, share information, share expectations, and share feelings. We like to do things in threes at Pickles Group. All right, so this first question, what about my kids? So a common response might be, I'm sorry you're facing this. It is so hard and so important. You know your children best, but what other patients have found helpful is. So that line, you know your kids best, right? Parents do know their kids best, but they've also never been here before. They've never done this before. And so while you may know your kids best, you may not know how to talk to them about cancer, and that's okay. How am I going to tell my kids? I wish you didn't have to think about this. Parenting is hard enough. Let's focus on what they need to know. What do you think they're seeing? What do you think they're wondering about? Or who can you have that conversation with? Who's there for you? I can't let them see me upset. It's so natural to be upset, and that takes a lot of courage, even just being upset, knowing that it's okay. Some parents can't make out the words about cancer or about their challenge without crying, and that makes sense. Sometimes kids will be like, "Don't cry, why are you crying?" They might want to console their parent, especially in a household where maybe that's not common or that's not comfortable. That's okay too. But for kids who maybe need to know that, like, it's okay to be sad, seeing that can be really helpful. I have to be strong for my kids. I think being strong is about being honest with your feelings and a chance to teach your children how to feel and cope with really hard things. I hope that cancer is the hardest thing that they ever have to deal with. And I know that there will be other hard things, and a lot of these skills are going to be transferable. I don't want them to be scared. Sometimes it's scarier for kids to not understand what's happening. And then this is another one that might be helpful. Maybe they won't need to know for a while. So if you've got the parent that's kind of avoiding it, maybe they're like, I don't want to have this conversation. I don't think I need to. I worry that they will learn about things from what they see and hear rather than their trusted adult. What are they seeing? What might someone else say? Right? We can't control everyone in the room. Even if a kid, you might be the nurse in the room that is at infusion and they bring their kid with them and you have no clue what their kid knows and you say something about chemotherapy and their kid is like, what's chemotherapy, right? The parent can't shield them or protect them from all those other interactions and overhearings. And so by being the person who shares that with them, it can really help. So I'm going to pivot to identifying how and when to use external resources. We will have time for questions at the end. So obviously, there are many of you who are at different institutions with different infrastructures, and so you may already have resources that exist within your system. So figuring out what those are and leaning on your own teams. Maybe you are the person that's like, "That's my job. I'm the one having these difficult conversations." Great. And if you're not, hopefully you feel more comfortable at least having those initial conversations, but really, who's on our team that can come have these conversations. We hear from a lot of different people. There are some oncology social workers who feel really comfortable having difficult conversations with adults but aren't as experienced with kids. There are also adult oncology social workers who feel really comfortable having all of these conversations. So really even asking yourself, like, how comfortable do I feel? We had the question at the beginning to be able to think about, what's my role and can I lean into this more? Pickles has a resource page. So of course we have our family cancer support kits, which I've talked about here today. We also have a list of a bunch of partner resources nationally, locally, as well as a list of resources. And we have some of them categorized in different community groups. And then, of course, self care. I know I'm preaching to the choir, but I always like to add these. As someone who worked in the pediatric ICU for 10 years, I know that taking care of others really requires us to take care of ourselves. And so it's not about, going to that yoga class or going for that run. It's really about self compassion and recognizing when you need it and that you need it and trusting that you're where you're needed most. That is like one line that I think can be really helpful because if you're someone who's like, I've got 20 patients to see and this parent is asking me all these hard questions about their kids, you might be in there longer. And so really trusting that you're where you're needed most. And I know that that can sometimes rub against maybe what the expectations are of you in your role. And so trying to acknowledge that. Also, trusting where we're needed most might also be with our own families on any given day. So taking care of ourselves and our people so that we can also take care of those around us. I want to talk a little bit about what we have coming up at Pickles Group. So we have a very robust Connect Over Cancer program, and we are currently enrolling for our summer cohort. So if you have families in your care who have children in first through 12th grade, they can sign up right now. So registration closes on June 27th. So we're about 6 weeks out. The program will run from July 20th through August 17th. We don't stop support over the summer. So this is sometimes a really good time for families. Sometimes it's not. They can also enroll in the fall if this isn't a good time. But this is our next cohort. A lot of families want to know what after this. They have a good experience, they want to stay, they make friends. We have something called Pickles Jars, and it's very exciting if you're following along. We are currently in our spring giving campaign so that we can open those jars to more kids so that they can have ongoing support on a monthly basis. And all of our experiences are intended to be closed, meaning that we're creating that jar, that container where kids are with the same group of kids over and over and over again so that they develop deeper relationships. Additionally, we do a lot of webinars. So this is our clinician-focused webinar, but we also have content-focused webinars. So those are all on our YouTube channel. We just had a Centering the Experience of Dads webinar. Our next one is Centering the Experience of Black Families in honor of Juneteenth. We'll have one in Spanish in September. We're doing one on breast cancer in October, and then incurable or terminal cancers in November. These are really meaningful discussions where I do a small portion of the talking, and then we pivot to a parent panel where you get to hear directly from parents and families on their lived experience having these conversations with their kids. And so all of those discussions are up on our YouTube channel, but you can also register for the upcoming ones as well. And those are appropriate for clinicians and families. So they're kind of for everyone. And the discussion is just really rich. And we partner with a bunch of external partners, so other nonprofit organizations centered on these different groups. And then if you want to volunteer with us, we also have our next volunteer trainings coming up in June. In our almost 4 years, some of these numbers on the screen are much higher now, but as you can see, we're really reaching a lot of youth, a lot of families, and a lot of providers. And some of what people are saying is that Pickles gave her a place where she wasn't the kid whose mom has cancer. At Pickles, she finally felt that someone understood, even though her friends had tried their best. Kids like the activities. They find them fun. They also learn things. Parents are seeing a release in their children. They're seeing an ability to have conversations about cancer. And volunteers are telling us that it's a wonderful place for kids to connect. So we're really focused on creating safe and supportive spaces where kids can have fun and talk about the hard thing if and when they want to. So next steps, you should request our support kits if you don't have them already. You will receive a follow-up email with instructions on how to do that. And refer families. If you have families that just popped into your mind right now, we would love for you to click the Refer Now tab. It's a short form. You do want the family's permission to share their information, and then we'll do the reaching out. We will call them, we will text them, we will email them. We will help them onboard their kids at a time and a pace that feels right for them. All right, so we have a little bit more than 10 minutes. If there are any questions, I can take them now. And I see that there is one. So I'm just gonna get out of my screen here so that if anyone wants to be seen, you can, and I can see you. But I see there was a question about what the follow-up is when a kid's parent dies. Yeah, so we actually have the jars, we have bereavement jars as well. So when a kid loses a parent, we have a process for sending them a gift and a card. The card is actually it's a letter written by Pickles Youth. So again, that kids supporting kids approach. We also have we're releasing a mascot plush in the coming months. And so that will be the gift that they receive. But that's just a little small, way to support kids. But then we have these jars, and some of the jars are bereavement jars where they're with other kids who have lost a parent to cancer. So they're able to stay right with Pickles Group and get that peer grief support as well. In terms of, and so how does it affect the other children in the jar? So we have dealt with this, and every situation is going to be a little bit different, but we kind of determine whether or not a kid stays with their existing jar for a little bit longer or they make that transition. And we figure that out with all of the existing families. So families are really aware that there's going to be kids in the experience that are at different stages or experiences. And so we navigate that thoughtfully. Often adults and parents worry about that even more than kids. Kids are usually pretty welcoming and inclusive of all experiences in the groups. The Connect Over Cancer group is specifically for kids who have a parent or guardian living with cancer. So we don't enroll kids whose parents are on hospice or bereaved in that time frame, just because the content is really centered around the treatment experience. The November training, so you're right. It's not on the website yet. We're still kind of pulling together our partners, but we will make sure that the registration form is available. And like always, you're probably on our email list. And so our e-blasts are really, really focused on kind of what we have coming up at any given time. But I can tell you the date, if you want to save the date, it is Wednesday. So that one is in honor of Children's Grief Awareness. And it is on November 19th. It's a Wednesday at 6 p.m. Central. That is for the how to talk to kids about advanced or end stage cancer. So that'll be the short webinar with the parent panel. I'm still determining when the clinician webinar will be that's focused on advanced cancers. So stay tuned for that. What other questions do you all have? Other questions? We've got time. Don't be shy. All right, I see a question. Yeah, good question. So sibling dynamic. So our groups are kind of dictated by registration at any given cohort. So we pair kids into age or development-based groups. So usually there's kind of a younger, middle, upper. We've gotten so big that we have like sometimes multiple of the same age group happening at any given time. For siblings, we really navigate that with each family. So obviously, if it's like a first and an eighth grader, they're not going to be in the same group. But if they're closer in age, they may be. And so sometimes it comes down to devices, it comes down to dynamics, and sometimes siblings really want to be together, sometimes not. So it's not it's usually putting kids in their age-based group and going from there. But but sometimes they might have a preference, and so we kind of navigate that with each family. I just listened to I popped into one of our groups because we observe and coach our facilitators, and we had sisters that were like on the same screen together, and it was working for that family, but it's different for everybody. Okay, we do not have specific jars for neurodivergent children. All of the kiddos are pretty much integrated into the groups. We may adjust a kid's group or jar based on their development. So, we've had chronologically older kids in younger groups depending on their development. So we navigate that. We still would kind of require kids to be at least a first grade level, only because the activities are so interactive and kind of art and play based that we want to make sure it's going to be appropriate and helpful for all the kids. And so we would navigate that with the family to make sure it's the right fit. We have also integrated young adults with disabilities. So we usually increase our disability inclusion age to 22 for kids who would benefit from engaging. We just have a different process for integrating that age group if they're in like a transitional program. Yeah, Megan, thanks for the question about the online group. So virtual has been the greatest impact for our organization. We do have in-person programming in Illinois and Columbus. They are extremely meaningful, and our virtual groups are very impactful. We survey the kids, the parents, and the volunteers after every group. And we have, I don't know the exact percentage, but it's in like the high 90s of would recommend it to other families. And kids report back on, the communication and coping and connection. After the groups as well. So they are very highly valued. And honestly, that's often how kids want to interact. They're very digitally savvy, and so it's very comfortable and familiar with them. It also creates a little bit of a barrier. We don't force anyone to participate in a certain way. So some kids may not have their camera on. They may use the chat, and our facilitators are trained to meet kids wherever they're at. We don't call on kids. We don't force them to participate before they're ready. We really believe that participation looks a lot of different ways. And so they're extremely valuable. In fact, in person is sometimes a lot harder to achieve. And we unfortunately have like lower attendance at our in-person programming just because there's so many more barriers to entry in terms of getting a kid to a group when a parent is ill, among other challenges. So we see a lot more attendance issues with our in-person program. Yeah, and so there's another question, what advice might you have for CCLS who may want to create an in-person support group for children? Yeah, I mean, absolutely. It's a really valuable way to get kids together and to have hands-on, materials and resources. And we do a version of it, but there's such value. We work with a lot of hospitals who may have some in-person version, and their kids still benefit from going to like the Connect Over Cancer program virtually, and those things can interface. We want there to be as many resources available for these kids as possible, and families can kind of self-select what works best for them. Um, we work a little bit with schools. We receive referrals from school social workers. Obviously, the number of kids in a school who have a parent with cancer is going to look different than working directly with an oncology social worker. And so we tend to get most of our referrals directly from hospitals, and we do a lot of clinician training. But these trainings are totally appropriate for schools as well. And so we've had a lot of people share our information with their school social worker, their school teachers, and teachers and staff are more than welcome and encouraged to attend these trainings as well. And I think it would really apply for talking to kids in the classroom about their parents' cancer. But we don't necessarily do teacher trainings directly at this point. Great questions. Thank you. Anything else? All right. We just have a few more minutes. If there's no more questions, you're welcome to drop. I'm committed to staying here. So if anyone does have a last question, I'm more than happy to take it. Otherwise, you will receive a follow-up email with the recording, as well as the direct links to a lot of the resources and referral forms that I mentioned, so that we can work together to support more families. And I hope that you walk away feeling like you have some tools to support your parenting patients. So thank you so much.
May I ask a question? I couldn't get the my chat to work, but I'm curious though for if someone wants to volunteer, I'm an AMFT, so for associates, because